Here are the top stories for today, March 19, 2021. From Russia with love and vaccines, the Gamaleya Institute's Sputnik V jabs get the nod for emergency use from the Philippines Food and Drug Administration. No entry for foreigners only. Filipinos who are not migrant workers are now allowed to enter the country amid a temporary travel ban to stem the surge in COVID-19 cases. Making services and transactions seamless, government officials urge Filipinos to register for the Philippine Identification System. And go or no in Boracay? The answer is in your mouth as the island approves COVID-19 saliva testing for tourists. Good day, I'm Marita Muaje. Welcome to the PNA Newsroom. Our starting point tonight, the Philippines has more choices among the world's COVID-19 vaccines for its inoculation drive. This as the Food and Drug Administration confirmed that it has given an emergency use authorization to Russia's Sputnik V vaccine. FDA Director General Eric Domingo in a briefing today said Sputnik V was granted an EUA following a thorough review of its data. Sputnik V joins the list of vaccines which got the FDA's nod for emergency use, which includes Sinovac, AstraZeneca, and Pfizer. The FDA earlier said it is set to visit the Gamaleya Institute in Russia, the manufacturer of the Sputnik V jabs. The country is expected to get up to 20 million doses of the Russian-made vaccines. Based on data published on medical journal The Lancet, Sputnik V has a 91.6% efficacy against COVID-19. President Rodrigo Duterte has approved the recommendation to administer the around 525,000 AstraZeneca COVID-19 vaccines as a first dose to medical frontliners. This as the country deals with another surge in COVID-19 cases. Presidential spokesperson Harry Roque said that President Duterte signed a memorandum allowing the use of all on-hand COVAX-donated AstraZeneca vaccines in order to protect a larger number of frontline healthcare workers. Health Secretary Francisco Duque III earlier asked the President to use AstraZeneca vaccines as a first shot to provide partial protection to medical frontliners. He explained that the time arrival for administering the 2 doses of AstraZeneca vaccines is 3 months, the same time the vaccines will expire. The AstraZeneca jobs that arrived in the country earlier this month are part of the 44 million vaccine shots to be donated to the Philippines through the COVAX facility. Malacanang is positive that the government can respond to the current spike in COVID-19 cases. It also floats the possibility of changing the quarantine status of the country by next month. The details from William Theo.
Presidential spokesperson Secretary Harry Roque Jr. and some healthcare experts agreed that the country can respond to the current spike in COVID-19 cases, particularly in Metro Manila. Roque said that while the spike has impacted the healthcare utilization of the country, steps are already being taken for the projections not to come true. He adds that the local government units already know what to do.
Kung talagang maging critical po ang ating healthcare utilization rate, then that may justify changing our quarantine status. So I'm confident na mapapabagal po natin. In fact, nakikita na natin na bumagal na, no? Hindi na po siya 5,000 plus, nasa 4,000 na. And I think we can further slow it down, no? Gradually. No?
Roque also floated the possibility of a more restrictive quarantine status in the country if healthcare utilization rate and bed care utilization reached the critical level.
Fix po ang ating mga formulas on quarantines. So kung talagang maging critical po ang ating healthcare utilization rate, then that may justify changing our quarantine status. But hopefully not po, no? Because I think the people and local government units and everyone now is contributing para mapabagal na yung pagkarat ng sakit.
Meanwhile, Health Undersecretary Leopoldo Vega said that the One Hospital Command can help coordinate referrals with other hospitals that still have allocation for beds, especially for moderate and severe cases. He said that compared to last year, the country is better off now in terms of managing COVID-19.
It is safe to say na nag-increase na ho ang capacity ng hospitals, lalo na yung private, kasi nasa 20% allocation na po sila. At saka yung government retained hospitals po natin ay nasa mga 32%. So, nag-improve na ho yung capacity at nagkaroon na rin good experience itong mga healthcare workers natin on how to treat itong COVID patients in both categories, the moderate and severe.
Dr. Salvania of the Institute of Molecular Biology and Biotechnology at the University of the Philippines also agreed that the country is now in a better position when it comes to managing COVID-19 cases.
I haven't had a death since January among my patients, and I've had very sick patients, including doctors in the ICU. So I think that from a completely medical standpoint, we're in a better position. Mas marami po tayong gamot. We have this One Hospital Command which is really coordinated. We already know what works. We have face masks, we have face shields, we have enhanced contact tracing. And the second thing is we need to make sure that for those who do develop severe disease, that we continue to have hospital beds open for them because we can take good care of them and mas mababa na po yung mortality compared to last year na left and right po talaga namamatay because we didn't really know what we were doing po.
Due to the rising COVID-19 cases, the local officials in the Metro Manila area decided to implement a 2-week curfew beginning March 15 and banned minors age 18 and below outdoors to help curb coronavirus infections. For the PNA Newsroom, I am William Theo.
All Filipinos abroad can now return to the Philippines despite a temporary travel ban to curb the surge in COVID-19 cases. The National Task Force on COVID-19 made this announcement on Thursday night. The Task Force Memorandum Circular Number 6 amends Memorandum Circular Number 5, which earlier prohibited returning Filipinos who are not migrant workers from entering the country. The travel ban, which takes effect from March 22 to April 21, suspends the entry of foreigners into the country. However, diplomats and members of international organizations and their dependents with valid visas, as well as foreigners involved in medical repatriation endorsed by the Foreign Affairs Department and the Overseas Workers Welfare Administration, are exempted from the ban. Also exempted are foreign seafarers who are holders of 9C visas, foreign spouses and children of Filipinos with a valid visa, and those classified as emergency humanitarian case by the NTF. The move comes as the Philippines grapples with a rise in COVID-19 cases and the entry of new variants. The Interagency Task Force on the Emerging Infectious Diseases orders the temporary closure of establishments in areas under the General Community Quarantine. Presidential spokesperson Harry Roque made the announcement today during his online press briefing.
Dahil nga po sa tumataas na kaso ng COVID-19, napagkasunduan po ng IATF na ipatupad ang mga sumusunod na hakbang sa mga lugar na ilalim sa General Community Quarantine hanggang 4 ng Abril ngayong taon. Ito po epektibo ngayon hanggang 4 ng Abril. Una, pansamantalang sinususpende ang operasyon ng driving schools, traditional cinemas, videos, and interactive game arcades, mga silid-aklatan or libraries, archives, museums, at cultural events, limited social events, at sa mga accredited establishments na inaprobahan ng DOT at limited tourist attraction except open-air tourist attractions. Pangalawa, ang meetings, incentives, conferences, at exhibition events ay magiging limitado sa essential business gatherings at 30% venue capacity. Pangatlo, ang mga religious gatherings ay kailangang mag-observe ng maximum 30% ng venue capacity na walang pagtutol or objection mula sa lokal na pamahalaan. Binibigyan discretion din ng mga lokal na pamahalaan na taasan ang venue capacity na hindi lalampas ang 50% base sa mga kondisyon sa kanilang lugar. Pang-apat, binabawasan ang venue capacity ng mga dine-in restaurants, cafes, personal care services sa maximum 50% capacity. Pang-lima, hinihiyakat ang mga ahensya ng pambansang pamahalaan na ipagpaliban muna ang non-critical activities kung saan magkakaroon ng mga pagpupulong-pulong or mass gatherings. Sinususpinde ang operasyon ng mga sabong at sabungan.
The Philippines and the private sector led by business tycoon Enrique Razon signed a tripartite agreement with American vaccine manufacturer Moderna to procure 20 million doses of anti-COVID vaccines for the country. Under the agreement, the Philippine government secured 13 million doses of Moderna vaccines while the private sector ordered another 7 million vaccine doses for its frontline workers. Vaccine czar Carlito Galvez Jr. said the signing of this tripartite agreement shows that our bayanihan spirit is truly alive. Meanwhile, Razon said his company is formally committed to manage and fund the entire international logistics effort for the Moderna order, as his company has an intrinsic and moral obligation to assist our countrymen in every possible way. Still to come, look who's talking. Mayor Sara Duterte has some strong words for a coalition claiming to be a united opposition for next year's polls. And heading out of town for the Holy Week, you might want to check some provinces' rules for travelers. More on this when the PNA Newsroom continues.
Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP, at ng himpilang ito.
President Rodrigo Duterte on Thursday took pride in his success in toppling oligarchy that has been controlling the country for a long time. Duterte was present in the Joint National Task Force, Regional Task Force, and Local Communist Armed Conflict Region 8 meeting in Tacloban City. In a speech, Duterte said he went after tycoons such as Lopez-owned ABS-CBN Corporation, Fernando Sobel de Ayala of Manila Water, and Manuel Pangilinan of Maynilad. He reiterated that he could not let Manila Water and Maynilad to take advantage of their consumers due to their supposed onerous water contracts with the government. Duterte also insisted that he would not allow ABS-CBN to resume operations under his watch until it settles its tax obligations with the government. Duterte chided the network anew for its supposed failure to air his campaign advertisements during the 2016 presidential elections. In July last year, Duterte first said he dismantled the oligarchy without the need to declare martial law. Mayor Sara Duterte slammed the opposition group Isang Bayan for claiming to be a coalition of democratic forces while rejecting those who disagree with them. Duterte said the group, which sounded authoritarian, should have called for unity if they wanted to succeed. The Isang Bayan, headed by retired Supreme Court Associate Justice Antonio Carpio, calls itself the only united opposition that could win against the current administration. Carpio said their goal is to endorse national candidates for the 2022 polls who would fight against the candidates endorsed by the Duterte administration. He said the group represents the democratic forces in the country, which includes the Bayan Muna, Magdalo, labor groups, the poor, and the religious. Duterte, however, said what country needs now is unity, not messages of rejection. The Lenten observance in Albay this year will be subject to strict guidelines while the province is under general community quarantine. This and more in today's provincial roundup from Lade Cabagani.
The Albay Provincial Disaster Risk Reduction Management Council modified the rules regarding the observance of Holy Week this year amid the continuing threat of COVID-19. Albay is currently under general community quarantine. This year, the faithful may be physically present in churches but only in limited number as only a 50% capacity is allowed. There will be no traditional Lenten events such as the blessing of the palms on Palm Sunday and the ceremonial washing of feet on Holy Thursday, veneration of cross on Good Friday, and salubong and pagtungtong on Easter Sunday. Meanwhile, Iloilo City Mayor Jerry Treñas has called for random testing of call center employees. This after 89 employees of HGS, a call center in the city's Montoriao district, have tested positive for COVID-19. The 17th and 18th floors of the building occupied by HGS have been closed off for disinfection while contact tracing is currently ongoing. Iloilo City hosts 45 business process outsourcing or call center companies, including small companies employing 5 to 10 workers. In other news, the Pangasinan Provincial Tourism and Cultural Affairs Office encouraged tourists to register with the region1.tarana.ph, an online portal to ease contact tracing for those who are infected with COVID-19. Provincial Tourism Chief Malu Elduayan said, although local government units have their own registration methods, they are encouraging tourists to go to the website for faster contact tracing. She also urged tourists to support the services of local tour operators in the province so they would experience first-hand satisfaction and enjoyment. Meanwhile, tourists, especially outside Pangasinan, are still barred from visiting and touring the provincial capital complex in Lingayen Town. For the PNA Newsroom, I'm Lade Cabagan.
Up next, the government continues to encourage Filipinos to register for the Philippine Identification System. And ready to flaunt that summer body in Boracay? We tell you later another option for COVID-19 testing before your escapade. The PNA Newsroom returns after these reminders.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
You're still watching PNA Newsroom. Filipinos are one step closer to easier access to basic services and more convenient transactions. This is through the Philippine Identification System, which has been making great strides since it kicked off registration last year amid the pandemic. Benj Bondok tells us more.
The vision of seamless and hassle-free access to basic services in both the public and private sector is getting closer to reality, as the country kicked off the registration for the Philippine Identification System or Philsis. For Pangasinan farmer Brian Gatchalian, the program brought him one step ahead in his dream of providing a better life for his family. After going through the simple registration process, Gatchalian was also able to open a bank account and avail of financial services minus the hassle. Government officials say Philsis is a game changer in the way services are being accessed by the people, especially for low-income households.
Ang PSA ay nakaangkla sa prinsipyo ng pagiging inklusibo. Nananatili tayong tapat sa intensyon ng batas na unahin ang vulnerable sectors ng ating lipunan. Ang Philsis ay para sa bawat Pilipino at higit sa lahat para sa ating mga kababayang nahihirapan sa pag-access ng tulong mula sa gobyerno dahil sa kawalan ng valid IDs.
Philsis will also spell convenience for Filipinos, especially in doing financial transactions. With the system making use of a universal and secure information database of all Filipinos, the requirement for a bunch of documents coupled with a number of various IDs for transactions will soon become a thing of the past. This comes as the government moves to ease the process of opening bank accounts for Filipinos as part of the transition into a digital economy.
Sa pamamagitan ng Philsis, hindi lang mas madali at magaan ang pagbukas ng bank account, kundi maaari ring mas mapadali ang paggamit at mas gumanda pa ang ibang serbisyo ng mga bangko at iba pang institusyon. Nabigyan ng malaking parte ang Philsis sa pagpapatubad ng BSP Digitalization Agenda.
The National Economic and Development Authority also assured that the Philsis registration process will be safe and easy, especially amid the pandemic.
Sa pagdating ng registration sa inyong lugar, nais naming bigyang paalala ang lahat na sundin ang minimum health standards kontra COVID-19. Makaaasa kayo na sisiguruduhin ng aming registration officers na masusunod ang mga pamantayang ito.
About 20 million Filipinos have already completed Step 1 registration for Philsis since its launch in October last year. The government aims to register at least 50 million individuals this year. For the PNA Newsroom, I'm Bench Bondok.
Cebu City officially started the Step 2 registration for the Philippine Identification System or Filsis on Thursday. Mayor Edgardo Labella said the Philippine Statistics Authority began processing applications for the national ID at the Robinsons Galleria Mall. Step 2 involves the capture of biometric information such as iris scan, fingerprints, and photograph. The registration will be done per barangay, which will set the schedule for its residents to avoid overcrowding. Labella said he is excited for the rollout, noting that the national ID system will help streamline information and transactions with the government. Aside from Cebu, Bohol and Negros Oriental are among the pilot areas of Philsis registration in Central Visayas. Housing Secretary Eduardo Del Rosario on Thursday vowed 75 million pesos for the construction of housing projects for former communist rebels in Eastern Visayas. Del Rosario, also the cabinet officer for regional development and security, made the assurance during the launch of the Barangay Development Program, a counter-insurgency plan aimed at delivering government programs in areas considered cleared of the influence of rebels. He cited President Duterte's strong political will and aggressive leadership to end insurgency in the country. Del Rosario also praised local officials for calling out the CPP-NPA for their atrocities and violence. Over 3,300 barangays declared persona non grata, the members of communist terrorist groups. All mayors and governors of the provinces of Leyte, Southern Leyte, Biliran, Samar, Eastern Samar, and Northern Samar did the same. Del Rosario also cited the efforts of various national agencies to end local terrorism while pushing economic development within conflict-afflicted communities. Tourists going to Boracay Island may now opt for a saliva test instead of the swab test as part of the requirements to enter the island. Aklan Governor Florencio Miraflores said the Boracay Interagency Task Force approved this proposal from the provincial and local governments of Malay in a recent meeting. He clarified that the use of saliva test will be limited only for Boracay tourists. Any tourist entering the island must present a valid RT-PCR test proving that they are negative for COVID-19. Apart from the negative COVID-19 test results, tourists must also send their confirmed booking form, ID, and travel details to touristboracay@gmail.com for the issuance of their QR code. Meantime, Miraflores said they will be issuing the necessary executive order and advisories to airline companies going to Katiklan regarding the use of the saliva test. And now for our sports news, the Bangsamoro Autonomous Region in Muslim Mindanao has granted a 10-year-old chess master an educational scholarship. The regional government vowed to provide financial aid to chess wizard Al-Bashir Buto for his training and in future competitions. Bangsamoro Transition Authority member Rasul Mitmug Jr. said Buto, who belongs to a Maranao family based in Cainta, Rizal, is the first and youngest Bangsamoro master chess player. He said the Bangsamoro Sports Commission seeks to develop athletes in the region like Buto so they can use their talents to represent its people. On Tuesday, the BTA passed Resolution number 356 commending Buto for his feats in chess. Among his achievements are a gold medal in the 13th Asian Schools Chess Championship in China in July 2017, gold medals in the 8th ASEAN Age Group Chess Championship in Malaysia, and a trophy at the National Group Chess Championship in Cebu. Here's another look at today's biggest stories. From Russia with love and vaccines, the Gamaleya Institute's Sputnik V jobs get the nod for emergency use from the Philippines Food and Drug Administration. No entry for foreigners only. Filipinos who are not migrant workers are now allowed to enter the country amid a temporary travel ban to stem the surge in COVID-19 cases. Making services and transactions seamless, government officials urge Filipinos to register for the Philippine Identification System. And go or no in Boracay? The answer is in your mouth as the island approves COVID-19 saliva testing for tourists. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head on to the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also, watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I'm Marita Muaje. Have a good day.